Introducing the all-new Corolla.
The July 16 guidance from the feds has created more questions, that are related to this healthcare law.
Health Chairman Senator Dennis Rodriguez Jr. is talking about the U.S. Department of Health and Human Services granting Guam and the territories exemptions from the Affordable Health Care Act, commonly referred to as ObamaCare. Guam's health insurance industry has asked for these exemptions because they've said that Obamacare has several unfunded mandates without any of the federal subsidies that health insurance providers in the states were getting. And they've said that this would have resulted in increased premiums.
There are some things that I think are good that's coming out of this guidance, some that may jeopardize the protections and the affordability of what this whole Obamacare, as it's known, was set out to be.
However, Senator Rodriguez says that there may be several benefits of Obamacare that Guam will lose out on because of this exemption.
Just as a cursory review of this and not getting the official rule from the feds is that you have things like the medical loss ratio rule that now won't apply to Guam. The medical loss ratio rule is the 80-20 rule, right? Where the insurance companies have a cap on how much they can make, and what is supposed to be set out to be paid for claims, and whatever's remaining of that goes back to the consumer for premiums that were overly paid.
This exemption from Obamacare may also end the requirement that insurance companies provide health insurance for pre-existing conditions, and the rate review process may also be in jeopardy. The rate review process requires that if an insurance company wants to raise its rates more than 10%, it must go through a rate review with the insurance commissioner. Senator Rodriguez says these are good mandates that would have really benefited the people of Guam.
What my next step would be is to ensure that the spirit and intent of PACA is preserved, even if it means we have to pass local legislation to make it happen.
Governor Calvo says that the intent of Obamacare was good, but the way it was applied to the territories was bad.
It was half-baked for the territory, so better not continue cooking it until we get something that is holistic, something that provides both the mandate as well as the necessary support and federal resources from the federal government. Guam needs to be treated equally. And again, it would have been very difficult, I think, for us, if we had all those subsidies. I think that would have been good. But we don't have the subsidies, we only had the mandates.